Every time an aesthetic surgeon puts someone's face together, he or she also puts a patient's life back together again. The healing, restorative powers of reconstructive surgery and its ability to knit families together, to rebind careers, to restore self-confidence and self-esteem have been the stock in trade of caregivers at the Max Institute of Aesthetic and Reconstructive Surgery. Ever since we opened our doors in 2008, the team at the helm of affairs has been setting new benchmarks in the areas of medical and service excellence. Executive Chef Bhupesh had not only baked to perfection but also provided the quintessential cherry topping on the wedding dreams of scores of couples. So when he and Satwinder decided to tie the knot, the meticulous planner did not want to leave anything to chance. He labored and fussed over every minute detail, even ensuring that he drives his bride back home after the ceremony. But alas, fate had other plans in store for them.
It was our wedding reception day. We were beginning a new chapter of our life. Everyone was in a happy mood and everything seems to be going in the right direction. There was a small part which actually went wrong, God knows why. We were returning back in the night of the function day, me, my wife and one of my friends also along with us. I was on the driving seat and while returning I found a dumper which was already in front of us, and while driving, suddenly the driver of the dumper applied his brakes abruptly. My vehicle went out of control. I could not hold it in that short span of time, and my vehicle went ahead and hit the dumper. We met with that accident over there and it was quite a fatal one. I could not realize what it was. I went point blank without any memory at that point of time. After that, when I recollected whatever memories I can, when I saw myself in the hospital, by that time I am surrounded with all my well-wishers, friends, Bijoy, Tushar, endless people, my family. That point of time I am still in a lot of pain and I don't know what has actually happened and what I have gone through or what my family has gone through. By that time when slowly doctors revealed me the whole thing, even my friends and family start telling me. Family were a little hesitant on informing whatever, but friends are there to support you as well as your family. They all were there, gave us all the inputs, whatever was we had gone through and all. That time when I realized what I had gone through, it was a very difficult thing to believe and understand that one was back into being where I was at that point of time.
It is incredibly difficult to diagnose serious facial fractures like these on a flat X-ray. We are lucky to have a state-of-the-art 64-slice CT scan machine in Max Healthcare which can reproduce a three-dimensional structure just like a live facial skeleton, as you can see here. This is the CT scan we did for Bhupesh after he was stabilized in the neurosurgery department. And as you can see, his face is actually smashed into bits. One can clearly see in this three-dimensional CT that his left eye socket is broken, his nose complex is completely dissociated from the skull, his right cheek and the orbital floor is smashed into multiple pieces, and so is his lower jaw as well. One doesn't know where to start and the face is in shatters. So the entire face is actually completely dissociated from the skull and it is almost like assembling a huge jigsaw puzzle together.
I was on call the night when Bhupesh was shifted from another hospital to our emergency in a critical condition. He was bleeding profusely from his mouth and nose. His face was badly smashed. His eye was beyond recognition. At that time we made him stable and then I gave a call to my chief who immediately came to review the patient.
9 hours. That's exactly what it took us to piece every fractured bone in his face to come together. Bit by bit, going from the known to the unknown territory, piecing every fractured bone in its right place, anatomically reducing it to restore the three-dimensional anatomy of the face. All the bones are precisely linked with micro mini plates made of pure titanium, which are actually drilled into place with precise micro drills. And this is a very delicate job. because we have to work around important vital structures in the face like the facial nerve, branches, and also having lost one eye already, we were very scared not to do any damage to the healthy eye. So especially the part which we did for fixing the floor of the right orbit, which was actually the healthy eye, was extremely difficult to do. But the meticulous planning that we had done, the thorough evaluation with the help of the three-dimensional CT helped us through the entire procedure, and in the end we were able to establish the accurate anatomy of the face together. The complex craniofacial techniques that the reconstructive surgeons have evolved allow us to expose an entire area of the face with cuts and incisions that are easily concealed and are cosmetic. So we can actually fix every bone in the face together and restore the face to its near normal anatomy and structure. Bhupesh has gone on to have an artificial eye done as well, and that moves exactly like the normal eye, and it also matches the other eye.
In spite of all the hardships and the hurdles, I'm back into action, churning out delicious cakes. It's all thanks to the plastic surgeons at Max that I'm now back into my own feet and working towards my new life. Cheers.
Picking up the threads of their life from where they had left, Bhupesh and Satwinder are back on track. Dowry since time immemorial has been the bane of existence of countless women in India. In today's day and age, sadly, this inhuman practice still thrives. Our next patient of courage is a woman of substance who, when consigned to the flames of fire, emerged strong and determined, the scars on her body notwithstanding.
मेरा नाम अलका है, मैं मैक्स हॉस्पिटल में काम करती हूँ। मेरी शादी 1994 में हुई थी। 2001 में मेरे साथ ये एक्सीडेंट हुआ जिसमें मेरे को 25% बर्न आया। मैं 1 महीना आईसीयू में रही। उसके बाद 2 साल मेरा कंटिन्यू इलाज चला, जिसमें मेरे इन-लॉज ने, मेरे हस्बैंड ने कोई हेल्प नहीं की। मैं फिर अपनी मदर के घर आ गई। मेरी मदर ने मेरी काफी हेल्प की, जिनके यहाँ मेरी मदर सर्विस करती थी, रेनू आंटी, उन्होंने काफी हेल्प की। जिसमें मेरे 2 बेटे थे, एक 6 साल का था, एक 6 महीने का था। उस बीच में मैंने मतलब काफी सफर किया। मेरी 2 सर्जरी हुई हैं। एक स्किन ग्राफ्टिंग चेस्ट की हुई जिससे मेरे जख्म नहीं भर रहे थे, उसके लिए। एक मेरा हैंड जॉइंट हो गया था, उसके लिए। फिर 2 साल के बाद मैं ठीक होने के बाद मैंने सोचा मुझे कुछ काम करना चाहिए, जो ऐसा काम हो जिससे कि मैं अपने बच्चे भी पाल सकूं और मैं दूसरों की हेल्प भी कर सकूं। उसके बाद मैं मैक्स हॉस्पिटल में आई। यहाँ पे आके मेरे को डॉक्टर सुनील चौधरी मिले, जिन्होंने मेरी नेक खोली, जिसमें मेरी नेक और शोल्डर जॉइंट थे। मेरे को प्रॉब्लम होती थी साइड में देखने में, स्माइल करने में काफी प्रॉब्लम होती थी।
Alka's neck was attached to the chest, and literally speaking, there was no neck. She could not move her neck because it was bent and stuck to the chest. She could not breathe easily as well. She had these bouts of breathlessness off and on. She also could not smile properly because of the contracture she had in the neck. The angles of the mouth, the lips were actually pulled down. The surgical challenge in Alka's case was to reconstruct the neck in its all three-dimensional glory so that it can move freely. The shape of the neck in 2 planes has to be restored, and as the neck was badly attached to the chest, the release of the neck was fraught with danger because we had to cut into the scar tissue which could be attached very closely to the major blood vessels in the neck.
We anticipated difficulties in providing anesthesia for this patient during surgery. For providing general anesthesia to these patients, we have to put in a tube into the trachea of the patient, which is then connected to a ventilator, and this tube provides artificial ventilation during anesthesia and surgery. This is a true lifeline of the patient during this intense period of anesthesia and surgery. To visualize the trachea, we have to straighten the neck of the patient, which was impossible in Alka's case. So, we used another specialized technique, like using of a flexible fiber bronchoscope to visualize the trachea directly under vision using a computer screen, and then we intubated this patient for providing anesthesia and surgery.
So we went slowly, separated all the tissues successfully, and at the end of this we had a huge raw area from the upper end of the neck to the chest. Now the challenge was to resurface this with a single sheet, a seamless